I think everybody is well aware to some extent of what we are experiencing in terms of the impacts on our hospitals and our healthcare system with COVID-19. And I think that's really going to be where a lot of our focus is going to be over the next few weeks. We are no longer at a place, especially with the Omicron variant, where we can control cases to the way we've controlled them in the past. Of course, we want to try and lower them as much as possible because the fewer people are infected with COVID-19, the fewer people can then become hospitalized. But I think the big focus is going to be much more on hospitalizations because we don't really have a clear sense of even how many people are getting infected anymore, given the limited testing we have available. If we take a look at what hospitalizations have been look like in the province here, this is kind of the curve you can see, where there's been the very sharp increase in hospitalizations over the last month or so, driven by the Omicron variant. And you can see, it is far higher than it has been at any of the previous waves that we have experienced in Ontario. And so this is very much a unique situation we're in. When we look at the ICU beds, definitely seeing that increase there as well. Fortunately, it is not as sharp. But, if you look at past waves where it maybe was more closely mirroring the increase, it's much lower this time. Nonetheless, it is going up. It is still going up, and that number is now higher than it was at either the first or second waves. It hasn't quite reached to where we were at the third wave, but I think it's definitely a big concern that we could be starting to run out of those beds very soon. And that's a very limited resource that we have in our healthcare sector. Taking a look here in Niagara, I think it's very much the same story. We can see our hospitalizations are really at an all-time high in terms of hospitalizations for COVID-19. And our ICU occupancy, unfortunately, here in Niagara is getting very close to where it was at the peak of the third wave at this point. So definitely there's a lot of stress on Niagara Health and the system there. Now, one debate that's been arising a lot has been in terms of our COVID cases, and if many of these cases are people who are actually not really very sick with COVID-19, they are being admitted to the hospital for other reasons, and that the COVID-19 infection was sort of found as a kind of incidental finding, that they just happen to be infected with that as well, but that's not really driving them to be very sick. There is some debate about how important those infections are, particularly given that sometimes it's hard to tease out what is the actual diagnosis someone is in. Nonetheless, our hospitals and Niagara Health have started to report on some of that data. Overwhelmingly, the people who are hospitalized but not being treated specifically for COVID-19 are fully vaccinated people. But if we look at then just the group who is being treated for COVID-19, this is sort of what we've seen over the last little while. And you can see even if we limit just to those people, we are still higher than we have been at the peak of our third wave, or higher than we've ever been in terms of hospitalizations for COVID-19. And so definitely COVID-19 is a real impact on our hospitals right now. Just taking a quick look here then at what we're seeing in terms of our cases. Again, we don't have a great accuracy of what our total infections are, so the case numbers are a bit of an underestimate. This is what it's looked like in the province, and this dotted line really represents the point where the province started to restrict people's ability to get tested. So, only the solid line is really even perhaps an accurate reflection of our infections. Even that solid line is perhaps an undercount because not everybody was able to get a test. You can see though with the dotted line, we've seen numbers come down a bit. That's probably partly a reflection that we're just not testing as many people. So a much smaller group of people is becoming diagnosed with COVID-19. And these are all, a 7-day average. So every point is kind of averaging the previous days. So it's not necessarily identifying a trend so much as it's maybe still picking up some of what we had seen before. Hopefully it is an indication that maybe at least in the highest risk group of healthcare workers who are largely the group being tested, we might be seeing a decline in infections there, which will mean at least our healthcare sector is going to have more people to work. This is, of course, also a group that was prioritized for vaccination. So there is some reason why we might believe that that subset of the population might be becoming less likely to be infected going forward. Taking a look here quickly at the Niagara data, it's somewhat of a similar pattern where there's that small downwards trend on that restricted group who's still able to get tested, which includes a lot of healthcare workers who hopefully are the ones who have their booster doses and are, hopefully going to be able to return to working in the healthcare sector. Given that we can't really rely on these case numbers to tell us what's happening with infections, I think we need to start looking at some other sources of data a little bit. One source people have been throwing around that might make sense is wastewater surveillance. And we've had that in place here in Niagara. The data from that isn't terribly illuminating sometimes. So I'll just give you an example here of the Grimsby wastewater treatment plant and what we see there in terms of what's being picked up. So, this data is unfortunately about a week old at this point, but this is the data that's being picked up. And you can see these big spikes basically represent signs in the wastewater that there might be COVID infections in the community. And when we start to think about these, there's this big spike in that first week of December, which doesn't make a total amount of sense because, of course, we didn't see the Omicron variant really build up until closer to the middle of December and the latter part of December. And then oddly, if there's a spike here, why are we not seeing a lot more evidence of infections going around here? Because this is actually when we saw a lot more Omicron cases in the Grimsby area. We do have, finally a big spike here coming right at the end of that first week of January. But this wastewater surveillance data isn't really correlating with what we've actually seen in terms of COVID infections in the area. And so I think we have to be a bit careful about looking at the wastewater surveillance and putting too much stock into it. That being said, if we take a look at a couple of our other wastewater treatment plants here, this is the Port Weller wastewater treatment plant in St. Catharines. This data makes a little bit more sense here. You start to see some increase through the early part and middle part of December, which kind of maybe is correlating with as the Omicron variant was building up and causing more infections. We have this big spike just after Christmas, and that sort of makes sense that maybe there was, a lot of infections spread around the Christmas gatherings, and so you'd see a bit of a spike, and then ongoing high amounts of, COVID detection in the water, implying that, we're remaining at a high level of infections going around still. There's a bit of a drop here, but you can see even here you go up and down, so it's not really very consistent. So I don't know if you want to read too much into that. At best, there's maybe a signal that things are flattening out at a very high level of cases, as opposed to necessarily going up or going down. But again, I think given how unreliable this data is, it's difficult to read too much into that. Looking at the Niagara Falls wastewater treatment plant, it's not too dissimilar from what we saw with St. Catharines. This makes a lot of sense that there's a bit of a spike in mid-December as we're starting to see much more Omicron cases, but then it seems to drop down for a few days, which doesn't make as much sense. Again, a lot of evidence of COVID-19 in the wastewater after the Christmas day, which I think makes sense given the Christmas gatherings. And then sort of this ongoing high level of evidence of COVID-19 in the wastewater since then, and not really going up, not really going down, staying at a pretty high level. And so, if I was trying to take a guess of what this wastewater data is saying, it's probably saying there's a lot of COVID-19 still going around. Maybe it's not really going up or going down, it's sort of staying flat. But I'm not sure how much we can read into that conclusion. The last thing that I'm taking a look at here is really the number of outbreaks that we have in Niagara. And my thinking here is that if we have, outbreaks, particularly in healthcare sectors, that's a setting where we're going to continue doing testing of people. So we're going to be able to pick up infections and outbreaks. And if we're seeing more outbreaks, that probably means that there's more infections out in the community. We'd expect as more infections in the community occur, there's going to be more infections making their way into these healthcare settings and resulting in outbreaks. And this is what we've seen in terms of outbreaks, where there's been this steady increase, and maybe over the last few days, it's flattened out a little bit. I'm a bit cautious to read too much into that because through the early part of this month, we were still confirming outbreaks in some congregate settings, whereas lately we've actually switched to only really confirming outbreaks in healthcare settings because the number is becoming too large. And so this flattening out might just be that we're still seeing more healthcare outbreaks, but we stopped counting the congregate setting outbreaks and we could basically substituted the healthcare for the congregate settings. I think we'll need to see where this goes in the coming days, but definitely there doesn't seem to be much evidence of a downwards trend here yet. Maybe it's flattening out. I think it might still be increasing, and it's just the way we're changing which outbreaks we're counting. And the fact we stopped counting congregate settings is basically hiding the fact that maybe this is still going up. So I think we are probably still in a place where cases might be going up, or infections, I should say, are going up in the community. At the very best, there's maybe some evidence it's flattening out and is going to stay at a very high level going forward. Key thing we're trying to do, of course, to get those infections down is what the province announced a little while earlier, a couple of weeks ago, around the new restrictions on social activity. And, for example, indoor dining being closed, indoor sporting events, gyms, etc., being closed. This orange line represents people's mobility, the measure of how much they're out and about in society. And you can see there's been a pretty sharp drop off on that. And actually, that mobility level, if you look, is starting to reflect where we were during our third lockdown back in, around this time last year. And so that is, somewhat reassuring sign that the measure the province took has had an impact, and hopefully we will see it, have an impact in terms of spread in our community and protecting our healthcare sector. When we take a look here in Niagara, I think we do see, the evidence of that as well. People doing shopping and recreation has definitely fallen. Here it hasn't fallen to where we were during a third lockdown or the second lockdown. We haven't come quite that far down, but definitely there's been an increase. So that's definitely good. That means that measure seems to be having some impact on people's behavior and will hopefully result in lower spread. People staying home, I think we see a similar events here where people staying home has jumped up. And again, that's, I think, more similar to where we were during the third lockdown. Not quite as high as we were during the second lockdown, but definitely those measures have had an impact in people's behavior changing. And I'm hopeful that that is going to result in the rate of infections in the community slowing down, and the new hospitalizations that our healthcare sector has to deal with slowing down as well. So it becomes a little bit more manageable for them, and we can hopefully get through this wave without too much more harm being done. This is some modeling put out by the Public Health Agency of Canada of where they think that the Omicron wave is going. And they've kind of tried to plot out these lines here. The red line would be if we had done nothing. The blue line reflects that Ontario and other jurisdictions are putting in place measures to slow the spread of infection. And if you look here between January and February, they seem to be implying that we might peak in sometime in the middle of January. So hopefully that does come out true. I don't know if we're definitely really seeing that evidence that it's occurring here yet in Ontario or in Niagara, but I'm hopeful that might be the case, and we will perhaps see that. And likewise, what they say is that if you had a peak in sort of mid-January for cases, you'd get a peak a little bit later than in terms of people being admitted to the hospitals. Now, one thing to note is that unlike the graph I showed, which is the total number of people in the hospital in any day, this is looking at the new daily hospital admissions on any given day. And you can see this dotted green line represents historically, in the past waves, what was the highest number of daily new hospitalizations we saw. And you can see right now in Canada, we're seeing more people being hospitalized any day than we have previously ever seen from COVID-19. And even if we are hopefully approaching that peak, you can see there's going to be a long period of time where hospitalizations are going to still be at a much higher rate than we have seen at any point previously in this pandemic. And so even if we are lucky enough to be approaching that peak, it's going to be a good 2-3 weeks before we get down to how bad things were in the, say, third wave that we were in, and the number of new hospitalizations we were seeing then. And so I think it's important to remember that we are in this for the long haul still. It's going to be quite a while where we continue to see high levels of infections going around. Of course, key thing for us to hopefully limit people being hospitalized and even control and reduce the amount of infections in our community is to get more people be vaccinated. And this is the latest data we're seeing here in terms of vaccination coverage in Niagara. So these are first doses in orange. These blue lines here are second doses. And then the green lines are people who've gotten their booster doses. And I think, some of the key elements here is that when you look up here, if we're looking at about 89.8% of people have gotten at least one dose, a little fewer than that, 87, some have gotten a second dose. We are more than halfway of actually getting these people booster doses. So the people who have gotten vaccinated or even actually got one dose of vaccine, more than half of them are now gotten a booster dose. And that really means, that's great news. The majority of adults more adults now have a booster dose than have 2 doses or 1 dose or are unvaccinated. And so the plurality of our population is now a group of people who have been boosted. And we can see particularly where the booster dose uptake has been highest is, of course, been in our elderly age group here, which is great news because this is the group who most needs that protection because of their greatest risk of having severe outcomes from COVID-19. So very pleased to see that, and hopefully we'll get these numbers from the 80s where they are to close to 100 in the very near future, given that we see these group of people have almost all also got their second doses at this point. One area where I continue to be a little disappointed in is the uptake we've had amongst age 5 to 11 children. We started doing second doses for this group, and I imagine over the next couple of weeks, we'll see this come up very close to that 43, 44% number that have a first dose. With the return to school, I would feel much more comfortable if we had a vaccination uptake for those children up closer to the 80% we may see for older teenagers and even for most adult groups. And that's a group that we're going to be doing a lot more promotion for vaccinations. We're also working with our primary care community to reach out to this population so we can hopefully get many more of them vaccinated in the coming weeks. So they're going to have that additional margin of safety when they get to school. If we take a look at our vaccine delivery here in Niagara, from delivering about 500 doses a day, back in November, you can see we're on many days at around 6,000 doses a day. Dipping a little bit on weekends, but back on weekdays, we tend to be closer to 6,000 doses. So we're definitely, got all of our partners across the region delivering much more in terms of vaccinations. That being said, I think in Niagara, we have the ability to do closer to 8,000 doses a day. And definitely in pharmacies, we're seeing fewer people getting vaccinated in the last little while. In our public health clinic in this Niagara Falls Convention Center, we have seen lots of appointments go empty and go unfilled in the last little while. And I think there's lots of opportunity for people to get those booster doses more quickly. People who have their appointments in the coming weeks, there's an opportunity for them to move those appointments up earlier and get them right away. Obviously not today, but tomorrow in the next few days, please book into those appointments so we can get those booster doses into people earlier and get them that protection from the Omicron wave as early as possible. And of course, for the people who have not yet signed up for a booster dose, there's lots of opportunity now, and we really hope people are going to sign up for that booster dose very soon. I just want to show you some of the data we're seeing in terms of vaccine effectiveness here. This is the Ontario data from the science table. And you can see that this orange line is to be coming admitted into an ICU. The yellow line is being hospitalized. And you can see people who had at least 2 doses of vaccine, very strong protection from being admitted to an ICU, quite strong protection as well, 80% protection that they're not going to be hospitalized. It's unfortunately not quite as good as the 95% that we were seeing against the Delta variant earlier. It has gone down a bit with the Omicron variant, but it still remains very good. A lot of people have really tried, focused undue attention, I think, on how with the Omicron variant, the protection from COVID-19 infection fell maybe close to about 15%. I think, it's unfortunate it's fallen by that, but what we're seeing is a lot of these infections are people who have minimal symptoms and in many cases, no symptoms at all. And I think, if you can experience that you're going to get COVID-19 and it's not really going to give you much harm and definitely going to prevent you from being hospitalized, I think that's absolutely a reason we want people to be vaccinated. You'll notice the protection from vaccination seems to have been increasing of late, and we've gone from about 15% and are now approaching close to 50% protection. And what I believe is happening here is we are seeing the impact of booster doses, because this is, of course, people who've had at least 2 vaccine doses. I think as booster doses have been rolled out, more and more people are getting more and more protection again. And those booster doses are driving up the protection. So with that booster dose, people are now becoming significantly protected against actual infection as well. And you can see it's approaching 50%, with only about half the people having got their booster dose. And so probably the true protection from COVID infection is probably closer to 70, 80% once we actually focus just on the people who've gotten that booster dose. So I think that booster dose is really important. It's giving people likely very good protection from infection, and it's going to increase their protection from hospitalization and ICU admission. And that's, I think, an important message we need to continue to emphasize to the public, that getting that booster dose is going to be really important. This is data from the nationally from the Public Health Agency of Canada, showing that unvaccinated people were 19 times more likely to be hospitalized than people who are fully vaccinated, even getting into late December in the Omicron variant era. And so absolutely lots of protection from COVID-19 if you get your vaccine. I just want to show some of this data here from the UK, which is some of the early data they're seeing in terms of the effect of that booster dose. So this is looking here at people who had 2 doses of, this is the AstraZeneca vaccine, and then they got a booster dose of either the Pfizer vaccine or the Moderna vaccine. Those are kind of the scientific names, so they're very confusing, but that's what those are. And these dark squares here represented protection from the Delta variant, and you can see 2 to 4 weeks out of getting those 2 doses of AstraZeneca, there's about 80% protection from infection. And that seemed to fall over time by about 25 weeks out, so about 6 months out. People's protection with 2 doses of AstraZeneca to the Delta variant had fallen. When we look at the Omicron variant, we sadly see that 2 doses aren't as effective, and you can see there's been this decline. And unfortunately, 2 doses of AstraZeneca is close to giving 0% protection against COVID-19 infection from the Omicron variant. We see that though when people got a Pfizer booster, that immunity jumped way back up and actually went over 60% once again. Unfortunately, over the course of weeks, it did decline a little bit, but still stayed above 40%. And so that booster dose made a real difference in terms of protecting people from infection, even if it did wane a little bit, and I think is an important reason why we want to get that booster dose. What I think is notable though here is if we look at the Moderna booster here, you can see actually the protection from infection from Moderna booster actually ends up being a little bit higher than it was for the Pfizer booster. And actually, if you look at then the waning you see over the course of time, the Moderna booster protection from infection doesn't seem to go down as much as it does for Pfizer. And so there's some evidence here that the Moderna booster may be giving you a little bit stronger protection and longer lasting protection than getting a Pfizer booster. Now, of course, in Niagara and in Ontario, we didn't do 2 doses of AstraZeneca for very many people, unlike the UK, where it was really their primary vaccine. Here we, of course, had a lot more people getting Pfizer and Moderna as their vaccines. And so the UK actually has some data on that. So these are people who got 2 doses of Pfizer vaccine now. And you can see protection from Delta variant was like 90% with the Pfizer vaccine 2 doses. Unfortunately, it declined a little bit over time and fell to maybe about 65% protection after about 6 months. You can see with the Omicron variant, not quite as good. The protection starts at close to maybe 60% and falls to maybe 15% or so, which is similar to what I just showed you earlier that we were seeing in Ontario data. When they get a 3rd dose of Pfizer, is that booster dose, they see their immunity jump back up. So their immunity actually goes right up to 70, and it's higher than it ever was with just the 2 doses. Unfortunately, there is some decline, but even 10 weeks out, they're still having a good at least 50% protection against infection. And of course, the protection from hospitalizations, ICU admissions will be a lot higher. Again here, when we look at the Moderna booster, we see that Moderna booster gives higher protection than that Pfizer booster. And then over the course of weeks, we don't see as much of a decline in immunity as we do see with Pfizer here. In fact, even with the decline in Moderna, it seems to still be on par or even higher than the peak of Pfizer booster. And so again, there seems to be some evidence that the Moderna booster gives a little bit stronger and longer lasting protection to the Omicron variant. And I think that's even data we are seeing in some of the early Ontario data. And you may have seen this messaging that we've been putting out here in Niagara, emphasizing that, which vaccine will you get if you come to our public health clinic? And people over 30 years of age, we are giving them Moderna vaccine because it has less waning of immunity, has higher effectiveness over time. And specifically with the Omicron variant, we are definitely seeing that this seems to be a slightly better vaccine to give people the stronger and longer lasting protection to the Omicron variant. When it comes to people who are under 30 years of age, because they have a higher risk of getting a myocarditis or pericarditis, that pretty rare side effect that affects the heart, but it does unfortunately happen a little bit more on younger people. And because the Moderna vaccine seems to be associated with causing it a bit more, we're giving those younger people Pfizer so that they don't get those side effects. They, of course, may not get quite as strong immunity, but thankfully, young people don't really seem to be as likely to be hospitalized or have severe illness in the first place. So I think that makes a lot of sense as a trade-off for them, where we'll, of course, protect them from the side effects from the vaccine, still then give them some very good protection, maybe not quite as good as the Moderna, but they're not going to need quite that protection quite as much. And so for people who are coming to our vaccine clinics, they can be assured that they're going to get the vaccine dose of Moderna, which is going to give them the best protection going forward and give them the best protection against this Omicron variant. The last thing I just want to quickly talk about is schools. And I was very excited to see children be able to get back into school today. And of course, Mother Nature has conspired against us. I think schools are essential in our society, as I've said before. And too often we've had a conversation of whether schools should be open. And I think the conversation should always been that schools should be open. What can we do to protect kids even more in terms of their attendance at school so that they have great protection? And through previous periods in this pandemic when we have had schools open, we have seen in Niagara that children are less likely to be infected in school than they were to be infected in their out-of-school activities. And at our last briefing a couple of weeks ago, I presented this slide really talking about how our efforts to keep children and teachers and other people safe in schools was going to shift a little bit. Particularly since we're unfortunately no longer able to keep cases low, there's going to be more cases out in the community, which does mean there's more chance that a teacher, a student might get infected out in the community and bring infection to school. So we're losing that line of protection. Because we don't have as much testing, we're not able to test everybody who has symptoms. So that is going to limit our ability to find infections a little bit. And if we're not able to find those infections, we may not necessarily be able to isolate any persons infected in their class and cohort to break off chains of transmission. But I posited that there's lots of things that we could still do here. And I think there's been some good progress on that. I think we are taking steps in the province to reduce cases in the community with some of those social restrictions. And I think that's great. And while we close those, we prioritize keeping schools open. So I think we're making good progress there. We're, of course, getting more vaccine boosters out, protecting the staff from infections. I'd hope we'll see more children and their parents choose to get them vaccinated as well so that they have that additional level of protection when they go back to schools. In terms of our vaccine clinics, since we have lots and lots of availability right now, we have sent a message through our school boards to teaching staff, inviting them to come to our clinics and get those booster doses so that they can have that protection as they return to teaching students in person. I argue that school children should be prioritized for PCR and rapid testing, and it sounds like that's happening, particularly with the rapid testing, with the province sending children home with a couple of rapid tests. That's going to really impact our ability to make sure we identify infections amongst students and amongst teachers and make sure that we keep them out of the school and keep everybody else safe. I argued we want to, improve on their masking, and the province is distributing high-quality masks to both teachers and to students. So that's definitely going to increase the protection. We are locally, therefore, working with school boards to see if we can tighten up rules around mask exemptions to make sure that people who absolutely need that mask exemption are going to have that exemption in place, but that we don't have unnecessary mask exemptions and that we have everybody wearing masks so that everybody is equally protected from each other. I think maximizing distance would be something I'd like to see us do. I know our schools are doing the best they can in terms of the current infrastructure, and hopefully we'll find ways to continue to improve that. The province has done a lot of work around improving ventilation and filtration. They've upgraded the ventilation system, the filters in schools. They've, of course, distributed HEPA filters. And I think all of that has done a lot of really good work in terms of increasing ventilation and filtration in schools overall. What I think we would like to do here in Niagara and what we're working with our school boards is now to do some on-the-ground additional work where we haven't just increased the ventilation in the school as a whole. We're now going to go into each classroom and actually take measurements and assess how good the ventilation is in that classroom. And if you find any classrooms where it's not as good as it could be, we'll be able to take some steps to actually improve that and really building on the good work the province has already done to put some additional measures in place so that we can protect additional classrooms. The one area where unfortunately we haven't seen much action is on the Immunization of School Pupils Act. And I'm disappointed that the province continues not to add COVID-19 as a 10th disease where we would use the Immunization of School Pupils Act to protect students. And, I continue to advocate that this is something a province should do. This act exists to protect students and teachers from outbreaks of infection in school. And of course, the infection is causing the most illness in our society that is overwhelmingly likely to cause outbreaks and spread in our schools is going to be COVID-19. And we have an immunization against it. It just makes logical sense that we would add that to this act. One other thing I want to speak to that we are doing locally is, I talked here that in the past we have isolated any infected people and their class cohort to limit the spread of infection. While we're not able to necessarily test everyone and identify all infections, thanks to the province distributing rapid tests, I think we'll be able to pick up many more infections. And so we are working with our school boards to see if we can still continue to do some level of this. Unfortunately, it's not going to be perfect, just given likely there's going to be a lot of infections going out in the community. But we think this could be an important step to make sure our school community stays safer, particularly if we do see unvaccinated people in a class where we are seeing infections. We would be looking perhaps to have them isolated out of the class to make sure we limit the spread of infection and keep everybody protected in that classroom. And so this is going to be something that I think we'll continue to do. I think this was a key measure that allowed us to keep schools as a place where children were less likely to be infected than they were in their out-of-school activities. And we, of course, want to keep it this case that when children are at school, they have a high level of protection and they're able to focus on their learning and really be able to have a healthy experience while in the school. So that's what we're doing for schools. And I'm just going to finish off here highlighting what the Public Health Agency of Canada really outlined last week. While we're in a sharp peak right now, and perhaps we might be approaching a peak soon, the decline in cases that is going to come will still be very high amounts of infection, and even the downside of that curve is going to be considerable, and it's going to continue to have an intense impact on our hospitals. And so everything we can do in the coming weeks to slow infection down is going to be really important. Practically what that means, I think our first line of protection remains vaccines, including getting a booster dose. And I encourage everybody to sign up in our vaccine clinics or go to a pharmacy or go to their primary care provider. All of us have capacity to get people booster doses, or if they don't have a first or second dose, to get those first and second doses to give people protection. I think as much as possible, if we limit our in-person contacts, we associate just with people in an immediate household, that's going to cut off opportunities for infection to spread and really going to help lower the infections in our community, and by in turn lower the hospitalizations and all the harm that this Omicron wave is causing us. And then of course, continuing to do everything else that we've done throughout this pandemic, wearing a good quality mask, staying in well-ventilated places as much as possible, continuing to keep distance, and all of the other advice we do. And I think if we do all of that, I think we're going to be able to continue to stay safe going forward through this pandemic. Of course, one thing that's going to be different is that we're no longer able to get tested as often. So we're not necessarily always going to know what's happening with our infections. And so it's important that we, of course, do all of these other things, because we're going to rely much more on these than on terms of identifying people with infection and isolating them. And I just want to highlight that, I've heard that there are some businesses, there are some places that still seem to expect people to get a negative test. And of course, given that testing isn't widely available, I think businesses and other locations should not be expecting people to get a negative test to, come to workplace or such, because of course that testing is not available. Instead, I'd encourage those workplaces to have a vaccination requirement for their employees, because that's going to be the first line of protection we have, and going to be the one of the greatest, ways to make sure we keep infection out of places in our community. And so I will stop there and turn it over to Courtney to moderate the questions.
Great, thank you, Dr. Hergy. Up first, we have Dawn, and you should be able to unmute. Okay, not seeing Dawn come off mute. We will try again later, and we'll move on to the next person, who is Ludwig, and you should be able to unmute. No questions from him. Okay, moving right along. Up next, we have Paul. You should be able to unmute.
Can you hear me okay?
Yep.
Can you hear me? Okay. Thanks, Courtney. Dr. Fergie, given you're saying that we're facing weeks more of intense activity and then weeks to follow of hospitalizations and ICU remaining high. So given that, do you think is it a foregone conclusion that the province should not be relaxing some of these restrictions that would be in place until January 26th, gyms, indoor dining? Is it just make common sense that we should expect those to remain in place?
Yeah, I don't want to say it's a foregone conclusion, but I do think it is going to be unlikely we are going to be in a situation a week, 10 days from now where we'll be able to lift those measures. I think ultimately we have to make these decisions based on the data at hand as we approach that, but it seems very unlikely to me that we're going to see a sudden turnaround in our hospitalizations and things to be significantly better 10 days from now. So I think that I would expect that we will see those extended, unfortunately.
And a follow-up?
Yes, and with the mandatory vaccination, the idea of kids being required to have vaccination to be in school in person as they are with other vaccines. I don't understand the reluctance at the provincial level, but do you have any idea on how quickly should they decide to move in that direction, that change could be in place? I mean, would it be a legislative change, or could it be some kind of an order by the province? And would it be weeks that could be accomplished in?
Yeah, so that change would actually just be a change in the regulations. The Act has a regulation that specifies the diseases where vaccination is included under the Act. And so it could be a regulatory change. Cabinet could make that decision. They would basically have to publish it. It could be a matter of days that change could be made. I do want to highlight, though, that the immunization school people doesn't require people to be vaccinated. What it requires is parents to make a choice about vaccination. So they either get their child vaccinated, they submit a legal notarized document saying that they have a conscientious objection to getting their child vaccinated, or they submit a medical exemption that their child cannot be vaccinated. And any one of those three is acceptable. So parents absolutely have the choice not to get their child to be vaccinated. They just need to affirm in a legal document that they have made the conscientious choice that they don't want their child to be vaccinated. And, once the child, those documents are in place, it doesn't necessarily impact what happens in school unless we in public health are concerned that there could be an outbreak in the school, in which case this becomes a tool we can use to perhaps manage the outbreak by suspending students who are unvaccinated. And so I think given that outbreaks are almost certainly likely with the COVID-19 disease, I think having this as a tool to help us stop those outbreaks and limit spread in schools would definitely be a useful tool.
Great, thank you. Don has let us know that he has no other questions. So we'll move on to Alan, and you should be able to unmute.
Very good. Hello. Okay. Wondering about the vaccine clinic at the Niagara Falls Convention Center. The scope of it, I mean, that place is humongous. Wondering about the capacity there, how it compares to what we've seen previously, why we're kind of moving towards a single location when historically public health has had multiple clinics concurrently, that type of thing.
Yeah, so our previous largest clinic was at the Meridian Community Center in Fonthill, where we could see about 2,300 people a day. The Niagara Falls Convention Center is close to about 4,500 people we could see at full operation. So almost double the size of that operation. The reason we did this is, of course, their Omicron variant was coming at us very, very fast. And so there was a need to maximize as many doses of vaccine that we could deliver as possible. And this was a venue that allowed us to run the biggest possible clinic possible. Secondarily, a lot of these locations, including places like the Meridian Community Center, were no longer available to us in December. They were being used for sporting activities, the recreational activities once again, and so we were not able to get access to those centers. And fortunately, this Niagara Falls Convention Center was a location that we were able to get access to. It met all of our requirements in terms of infection control to run a large clinic. And fortunately, of course, it gave us a much larger space. One other challenge that I was talking about in past weeks is that there's a lot more barriers to us delivering vaccinations right now in public health. We have seen attrition of our staff as this pandemic has gone on. Our entire healthcare sector has actually seen attrition of staff. And we are, entire health sector is actually struggling to have staffing in place. And running one larger clinic rather than perhaps multiple clinics that adds up to the same number of doses. One larger clinic gives you more economies of scale, lets us operate it with fewer people. So this was really the way that we will be able to maximize the number of vaccine doses that we could deliver initially. And so that was a lot of our reasoning for doing that. One other difference right now between the current situation and where we were in the spring and summer is back in the spring and summer, our limiting factor of delivering vaccination was always the number of doses of vaccine that the province was receiving from the manufacturers and able to send to us. So we would deliver vaccines as quickly as we received it. It generally wasn't enough vaccine that it would justify running a clinic in a place as large as the Niagara Falls Convention Center. Now we're in a situation where we actually have lots and lots of vaccine. We're not actually in a restricted supply of vaccine. There is some limitations in getting access to the Pfizer vaccine, but we have tons of Moderna vaccine. And as I showed you, Moderna is actually the preferred vaccine product anyway, so it's not really a concern for us. And so, there's no reason why we need to limit ourselves to a smaller clinic, and it made sense to go to the larger clinic, get people those booster doses, or if they don't have a first or second doses, that first and second dose as quickly as possible so they have that protection. In the coming weeks, I think you will see us switch away from running clinics at the Niagara Falls Convention Center and going back to running smaller clinics out in the community. I think, the Niagara Falls Convention Centers are great for the people who are able to travel and make it to this clinic, but we recognize that there's going to be people who are going to have struggles getting to that clinic. And so we will need to offer some more local options eventually to help other people get the booster dose who have not been able to make use of this. I do want to note, though, that if people don't have access to transportation through the Niagara Regional Transit and local municipal transit networks is free if you're going to go get your COVID-19 vaccine. So there shouldn't be a cost barrier to that, but I do recognize it may take a while to travel through various connections to get to that clinic.
All right, excellent stuff. Thank you so much. Health Canada just approved a new antiviral, I understand. Just wondered if you could talk to us a little bit about that. Is it going to make a huge difference, do you think, in terms of treatments in hospitals and such, or perhaps preventing them? I don't even know if it's going to be something we could buy over the counter, or what the deal is with it.
Yeah, so I haven't seen the news yet, but the rumor was that Pfizer's Paxlovid medication would be approved today. So I'm assuming that's the one you're referring to. This is an antiviral medication. So, how an antibiotic fights off a bacterial infection and antiviral fight off a viral infection. We do already have one antiviral that's been approved and licensed in Canada, which is remdesivir. But that's actually an IV medication. So you do need to actually go to a hospital. You might not need to be admitted. You might just be an outpatient at the hospital, but you need to visit the outpatient clinic to get that IV medication. What's really great about the Paxlovid medication is it's going to be an oral medication. So a physician could prescribe it. You'd take that prescription to a pharmacy. You'd get the pills. You'd be able to take those pills on your own. It would have no impact really on the larger healthcare sector after the point that someone has given you that prescription, and the pharmacy, of course, who dispenses you that medication. I do believe it is going to be a prescription-only medication, so you will need to have that prescription for it. And what the data showed with this in the clinical trials for this medication is that for high-risk people at highest risk of having severe outcomes from COVID-19, if they took that medications prophylactically, it could actually prevent them from being hospitalized. So that would make a huge difference in reducing burden of infection to the community. And for people who initially get COVID-19 infection, they have a mild infection, but of course, people at high risk over the course of days, it might become a severe infection. If they took this medication early on from their course of illness, it would prevent them from getting worse to the point where they would need that hospitalization. So again, really helping relieve the pressure on hospitals. So this medication has lots of potential that it could reduce the pressure on hospitals and really help people who are at high risk of getting severe illness really stay with just a mild illness where they get some pills, they take the medication in their home, and they actually get better in their home. I think the one challenge is going to be how much of this medication are we able to get into Canada? The US, the UK have licensed this medication, perhaps some other countries have. all of us are dealing with the Omicron wave. All of us need this medication right now because we're all seeing our hospitals stretched. And I wonder if there's going to be enough medication to go around. And I worry we're only going to see a limited supply of it. Of course, any supply is better than nothing, but I do worry it's not going to be nearly enough to actually give out to everybody who you'd ideally like wanted to prescribe this medication to.
Absolutely, it makes sense. Thanks so
Great,
much.
Thank you. Thank you. Okay, up next we have Penny, and you should be able to unmute.
Hi, yes, thank you. Dr. Hergy, I heard you describe your goal with getting the Immunization Act to include COVID-19, but you spoke a little before that about also separating kids. I thought you meant right away, separating kids in school who are not vaccinated if there is an outbreak. So there's really two questions that I have regarding that. And one is, how do you intend to separate them? Do you intend to ask them to stay home? And the other is, will parents know if there's an outbreak in their kids' classes? Because I understood the province wasn't going to do that, but I'm not sure what we're doing in Niagara.
Yeah, so on the second part, we are working with our school boards to find out a way where we can continue to get the information and actually inform parents of this so that they would be notified of that. And part of that notification would be the advice that if your child is unvaccinated, they should be staying home at this point. If they are vaccinated, it would be the parents' choice if they would continue to have their child attend school or not. And so that's going to be a bit of a local deviation from the province's plan that's been put forward, which I think we're going to be able to make work in Niagara, hopefully through the cooperation of our school boards.
And a follow-up?
So you won't force children to stay home if they've been unvaccinated, if they're unvaccinated and there's been an outbreak in schools. That will still be up to parents?
It'll be the direction we provide to parents. Without the Immunization of School Pupils Act, we won't have all of the detail to quickly identify and cross-reference a class list with vaccination lists to really be able to do it in a much more intensive way. But in any situation, it's difficult to send that notice. We're always going to require the cooperation of parents with what our advice is, and our advice is that they should be keeping children home and not be sending them to school.
Okay, thank you.
Okay, with that, we've come to the end of the list and we still have a few more minutes. So if anybody has a second question that they'd like to ask, if you want to let me know in the chat and we can unmute you to ask your question. Okay, not seeing anybody message in the chat, so we'll end things there. Thanks everyone for attending and we'll see you again in a couple weeks.